Good morning, beautiful people. It's your favorite girls, Michelle, here in the building. So if you did not subscribe yet, please hit the subscribe button. So that means that you will be able to join my amazing YouTube family. And if you've been here before, thank you so much for coming back. So in today's video, I would like to talk about being a nurse in a nursing home and being a nurse in hospital, and the differences, because I've been practicing as a nurse since 2020, and I've been working in both hospital and nursing home. And even before qualifying, I used to be a carer in a nursing home for 3 years, so it's a word that I kind of know. So working for the NHS means that you're working for the National Health Service, which means that you are working for a public hospital that offer a free health care support for ill patients. So that means that you're working for a public sector. And working instead for a nursing home means that you're working for a private organization or a private institute where there are different range of people that have different needs, and you are there just to support them and just to help them to live their own basic life. So one of the differences between a nurse working in hospital and a nurse working in a nursing home is that you are dealing with two totally different people. So in a nursing home, you are dealing the majority of the time with people that have chronic illnesses. Chronic mean a disease that they had it for sometimes. In fact, the word chronic or the word Crohn's mean time. CHRON mean time. So you are dealing with in this case resident that, for example, they have diabetes for number of years, or they have stroke in the past. So they came in a nursing home because, for example, they are living alone, or they are living with relatives that are not able to look after themselves properly. Since they are not able to look after themselves properly, or they need a 24-hour service, that's why they are in a nursing home. Why in hospital you have people that are most of the time acutely ill. That means that probably they have a new illness that they did not have it before, so they need to go to a hospital in order to get treatment. Or they had a disease, for example, diabetes, but they don't manage their diabetes properly. That means that sometimes they are hypo. That means their blood sugar, the level of sugar into their blood is low, that they need to go into hospital in order to find a doctor or a nurse that can get a plan in order to manage their diabetes well. Or maybe the blood sugar into their own system is so high that they need to go into hospital in order for the specialist in hospital to find a solution in order for them to manage their diabetes. So I would like to understand. I would like to make you understand that there are different people in a nursing home, and there are different people in a hospital. In a hospital, you deal with acute patients. In a nursing home, you deal with patients that have chronic disease, that they had it for years, so they just need a nurse in order to maybe to give them their tablet and to monitor them. So that is one of the difference between working in a hospital and working in a nursing home. So another difference is that when you're working in a hospital, you are working in a bigger place. So you're working in a bigger institution that have nurses, they have doctors, occupational therapists, physiotherapists. So you're working in a bigger environment. So I feel like you have more support. Working in a nursing home, in the other hands, you're working in a smaller institute. That means that most of the time you will find yourself that you are the only nurse in the whole building. Yes, it happened. So I feel like the support is limited. So what does it mean? That does mean that in a hospital, if you have any problem of like, if you need help or you have any problem and you don't know how to deal with that, you can rely on your colleague, you can rely on doctors in case you have like a situation that you don't know how to deal with. You have people that can help you, and you can even phone a doctor to come and review the patient in case there's any changes. So you have that support. Why, when you are in a nursing home, if there's anything happen with the residents, first of all, you are the first one that will need to be called out. For example, they are like in a nursing home, usually there are different units. If you are in one unit, if something happened in another unit, most of the time there's not a nurse there. And even if there's a nurse there, you will be called to go there and try to deal with the situation. And I feel like the level of support in a nursing home is limited. Therefore, you really need to know what you are doing. Most of the time when I go to a nursing home, I find myself to be the only nurse in place, which it can be scary. And if like you lack confidence, or if your competencies are not okay or are not up to date, you might struggle. So that's what I would like to let you know, that if you choose to work in a nursing home, be prepared with that. I'm not saying by any means that there's no support on a nursing home. I'm just saying that the support you get in a nursing home is different comparing to the support you have in a hospital. Because in a nursing home, in a day shift, sometimes it's only 1 or 2 nurses for 6 residents. Why in a hospital, in every single ward, there's at least 2 or 3 nurses, sometimes even 4 and 5, depending on how many patients you have in the ward. Why in a nursing home, for example, you can find yourself to deal with like 24, 25, 30 residents in the same building, and you are the only nurse available. So there is a reason why as well, because as I said before, in a nursing home, residents are not clinically unwell, so they require less support and they require less attention compared to being in a hospital and find yourself that maybe you are dealing with 6 or 7 patients that are clinically unwell. So you are required to give them more attention and more support because they are clinically unwell. So that is one of the difference between working for a hospital and working for a nursing home. Another difference I feel like is when you're working on a hospital, you're working in a more clinical area. I'm not saying that a nursing home is not a clinical area. It's a clinical area, but in a different way. Because, for example, if you are in a nursing home and someone get unwell, what is the first thing that need to be done? Sorry, you need to phone an ambulance, because the patient need to be transferred to a hospital in order to get blood check, like get all the examination that need to be done in order to find out what is going on with the patient. In a hospital, if you take unwell, everything is in place. For example, if you take unwell, a doctor will be called to come and review your situation. So they work differently. Both of the setting work differently in few words. Another difference that I find out why working as a nurse in a nursing home and working as a nurse in the hospital is that I feel like sometimes when I work in a nursing home, I don't use all my skill. And if, for example, you stop working in a hospital and you go to work in a nursing home, you will find yourself that with time you lose your skill that you gain while you were in hospital. Because for example, in nursing home, you don't administer like IV drugs, for example. When I say IV, intravenous drugs. So because the intravenous drugs need to be administered through a vein, and that can be done in a nursing home. In order to get that done, you need to get transferred in hospital. But you will find yourself that when you go to hospital, almost all nurses, apart from obviously newly qualified that has just came into the job, can administer a drug through the vein. But in a nursing home, you won't be able to do that. That's why I'm saying that when you are in a nursing home, you get to lose your skills because you don't administer drugs through the vein anymore. Most of the time, you don't check their vital signs. That means that you don't check their blood pressure, you don't check their heart rate, you don't check their temperature, and you just check those vital signs in case a patient, in case a resident like is not well at that time. So that is where you check them. But in a nursing home, you don't check them on a regular basis. But in hospital, you check them in a regular basis because it's a more acute setting, it's a more acute place. So blood pressure get checked every single time. So hourly or 4 hourly or 12 hourly. So every day you check the vital signs of a patient. While in a nursing home, you just check them in case their clinical I don't know, they become clinically unwell. That is when you check them. So I feel like that is one of the differences, that while you're in a nursing home, you lose your skill. For example, I know that in some nursing home you can take blood, but in hospital you get to take blood almost every day if you want. While in a nursing home, you tend to take blood only for example, if like there's like for example, if a patient is diabetic, they need to get their blood checked like every 2 or 3 months now. I don't remember exactly when, but they get their blood checked like periodically just to check some level. So I feel like when I'm in a nursing home, I kind of I do almost the same thing. I give medication, and if a patient is unwell, I take vital signs. So it's like a regular routine. Like you give medication, and after you give lunch medication, and you give tea time, and after nighttime medication. While in a hospital, you are more like clinically more clinically involved comparing to a nursing home. So I feel like when you go to a nursing home, you kind of know you don't use your skill. And if I've been always told that a skill that you don't use is a skill that you lose, unfortunately. And another thing that I noticed is that nurses that has been working in a nursing home for a long time tend to forget about their skill, and they tend not to, they lose their own competencies, and a lot of the time they are scared to go to work in a hospital because they lose like those skills that they got when they went to university, because they don't use them that often. So the competency that they used to get into hospital, since most of the time is not there anymore, they feel like they are not able to work in a clinical sector that is a hospital. So that is one of the things that happen. And even nurses working in a nursing home, they say that as well. And another thing I realize, it's easier for a nurse working into a hospital to go to work into a nursing home than a nurse working in a nursing home to go to work in a hospital, because there is more pressure in a hospital. I'm not saying that in a nursing home there's no pressure. There are pressure there as well, because you are dealing with more people in the same place. But when I say that there's more pressure, is that in a hospital, for example, if a patient get well and get discharged, by the time that the patient is discharged, you find yourself that you have another patient. So you need to try to understand what is going on with the patient, how to deal with the patient, what to alert, for example, to understand what's going on with the patient, and if there's anything that is wrong with the patient, you, for example, need to do a referral for, I don't know, for a tissue viability nurse that deal with wounds. You need to do a referral or ask for a review to a doctor. So a hospital is a place where you are constantly under stress. Even if you have less patient, you're constantly under stress because a patient has so many stuff that goes on. For example, they can have breathing issues. They can have like, I don't know, there's a lot of that can go wrong with a patient that in a nursing home, most of the time, you don't get to like experience that because you are dealing with patients that are clinically well. So the pressure between working in a hospital and the pressure between working in a nursing home is totally different. Therefore, the support that you get into a nursing home and the support that you get into when you are working in a hospital is totally different. Most of the time as well, in a nursing home, as I said before, you're only the only nurse. So you find yourself that you deal with everything. But in a hospital, since there's more pressure, there are people available there. You have the charge nurse, you have the other staff nurses, you have the senior charge nurse, you have the lead nurse, you have the doctor, like the senior doctor, you have consultants. So it's two totally different settings. Now, what is my advice on that? So it depends on you. It depends what type of person you are. So I'm one of those nurses that I don't want to lose my skills. I'm even every day try ways on how to improve my skill, on how to gain more skill. So that is the type of person, and that is the type of nurse I am. So I don't see myself at any time working like only on a nursing home. No, I always will be working in a hospital because I feel like it's stimulating. It stimulates my skill and it makes me like think. I'm not saying that in a nursing home you don't need to think, but as I say, that since you are always like deal with patients that are clinically unwell, your head is always like working. What is the strategy you need to put into place in order to make the patient better? So you're always thinking, you're always dealing with new stuff every single day. So that is the true differences. And another difference between working in a nursing home and working in a hospital, I feel like working in a hospital, you have more opportunity to climb the ladder. That means that you can decide to climb the ladder in two different ways. For example, you can choose to be a manager. So you will like decide to be a charge nurse. That means that you're supporting the other staff nurses in the work. Or you can even fight in order to become a senior charge nurse. So that is in the if you want to be like a manager and want to develop your skill in a management setting. But if you want to develop your skill in a clinical setting, for example, you can decide to apply for like a specialist job. For example, you can decide to go for a like diabetes specialist. So that means that you can go back to school and like do some modules and become a diabetic nurse, or even you can just decide to be a nurse practitioner. And the good thing about being on a hospital nurse, a lot of health board can like finance your studies. For example, there is what we call here Annex 21, which is like one of the nurse practitioner role, which you just need to apply for that. And if you are successful in the interview, you can just be put through all the training, and you can go to university, and the NHS, which is the trust, can finance you. So that means that in the end of all your studies and in the end of all your modules, you can be a nurse practitioner. while you gaining more experience, you can even end up being an advanced nurse practitioner. That means that you will be able not only to give medication, you can be a prescriber as well, which is a nurse that can like prescribe medication, which is a band 7, which I feel like there's more opportunity to be able to climb the ladder. While in a nursing home, you can obviously be like a manager of a unit, but I feel like if you're a nurse and after you become like a clinical manager and what else, I feel like you're kind of limited on what you can do. While in hospital, you can do so many stuff. You can be a diabetic nurse, you can be a stroke nurse, you can be a Parkinson nurse, becoming an advanced nurse practitioner, and becoming a lead nurse. So they are like, it's a broader picture of how many stuff you can become or you can do. So that is one of the difference I feel like you can like have when you're working in a nursing home or you're working in a hospital. So salary wise, like when for example I consider the money you get in 1 hour, the private sector always pay more. For example, a nurse in a nursing home get like hourly rate, she get more comparing to when you start in a hospital. But one of the difference between working in a nursing home and working in a hospital is that if you work Monday, if you get, for example, £20 working on Monday, you're gonna get the same £20 working on a Saturday or on a Sunday. So the only time that you get more money is when, for example, you work for days like Christmas Day or New Year's Days or bank holidays. You don't get like unsocial hour money. While in hospital, you get unsocial paid. So if you work on a Monday, your pay is gonna be different comparing when you're working on a Saturday or on a Sunday. And so that is the difference. And another difference, in a nursing home, you don't get paid sick leave. So if you're ill, you get just your statutory sick leave, which is peanut comparing to while you're in the hospital. If you get sick, you still get paid your full salary if you've been long enough in the NHS. When I say long enough, maybe, I don't know, 1 year or a year and a half, you get sick leave, and usually is your full salary. But in a nursing home, you get your statutory sick pay, which a lot of people cannot afford that. So that is one of the advantages and the disadvantages between working for both nursing home and the hospital. And another example I can think about the difference between working in a nursing home and working in a hospital. In a nursing home, while you're working in a nursing home, you get to know your residents. So I feel like that is an advantage about working in a nursing home, because majority of the resident living in a nursing home, they are there like for a long time. So you get to know them, and you get to build up that therapeutic relationship. While in hospital, unfortunately, you tend not to do so because it's a clinical environment on a fast pace. So that is one of the difference. It's a fast pace in hospital, while in a nursing home it's not a fast pace, because most of the time you will always have the same residents and you do always the same stuff for them. So I feel like that is one of the difference. And in hospital, you tend not to know your patient well, because they are not there for a long time, unless maybe they are in like in a care of the elderly unit, where patients tend to stay longer. But even if they don't stay there forever, so they end up going home, they end up going back to their nursing home. So a hospital is a more fast like place, while in a nursing home it's a more static place, because residents are there. It's like probably they are forever home, so they are there and you just look after them, and if they get unwell, you just go you just phone the ambulance for them to get to the closest hospital. So that is basically what are the different that I noticed. So now it's up to you where you choose to work. So if you are a patient, if you are a nurse that doesn't want to deal with like clinically unwell patients, fair enough. That means that probably working in a hospital is not for you. But if you are a nurse that like everyday challenging, like to learn new stuff, I feel like nursing home is not the place for you. But I enjoy regardless both places, working for a nursing home and working in a hospital. So it's up to you. I hope that you enjoyed this video and let me know what do you think, and just feel free to like, share, subscribe, and I hope to see you in my next video. So you take care. Bye.